I lay on the cold, hard hospital bed as she took a vial of my blood, then another, and finally a fourth. The severity of what was about to happen to me had finally sunk in. Tomorrow, I'd be unconscious for hours in a room full of strangers, my health and body solely in their hands. When I was 12 years old, my family noticed that I was walking with my right shoulder and hip higher than my left. Initially, we discounted it as bad posture, but when it persisted, we consulted an orthopedic surgeon. After a series of tests, I was diagnosed with adolescent idiopathic thoracolumbar scoliosis at the age of 14. At that age, it was too late for me to use a back brace to correct the 35-degree curve in my spine, and the only option was a spinal fusion surgery. As afraid as I was to go through with the surgery, the long-term consequences of not having treatment were far scarier. I was told I could have chronic pain with a worsening curve, or even have complications with a pregnancy if I chose to have children. At 16, surgery seemed a lot easier to deal with. After I received my diagnosis, all I could think about was, why me? Only 2 to 4% of children between the ages of 10 and 16 are afflicted with idiopathic scoliosis. The upsetting answer I received was that the very word idiopathic meant that no one knew the answer to why me. The cause of my condition was unknown and impossible to deduce. And being a child who had questions about quite literally everything, it was maddening not being able to scratch that itch in my brain. So, I underwent the surgery with no understanding of what was coming. For the first 2 days post-surgery, I was on very heavy painkillers that masked and minimized my pain. So I was determined to go on lighter medication as soon as I could. The third day post-surgery, I walked, stood, and sat up for the first time. The medical team attending to me started reducing my IV painkiller doses and started to give me orally administered medicines, upon my reassurance that I was already feeling better. I managed to get through the day okay, with a handmade bouquet from my friend cheering me up. But the third night post-op, I experienced excruciating pain. My resolute refusal to take IV painkillers was the primary cause. I had forgotten what it felt like not to be in pain. I was in agony, I had shivers up and down my right leg, I had trouble breathing, my heart rate shot up, and this sudden pain sent me into a state of panic that only aggravated my condition. It got so bad that I was essentially begging the nurse to give me some medicine that would help me fall asleep. I felt instant relief as the nurse administered the drugs through my arm. A kind of elation that a weight had been lifted off me. However, as the effect of the medicine wore off, I could feel the pain creeping back in. Looking back on what happened that night, I felt angry about letting myself slip into such an intense panic episode that aggravated my pain so much that I had to beg for medicine. My anger dissolved into self-speculation. And after I was able to think rationally, I realized that I was being extremely impatient with myself and my body. I was hurriedly trying to reduce my painkillers, thinking it would hasten my recovery, but all it did was inhibit me from a healthy one. When I understood and accepted this, I felt better both mentally and physically. I was able to focus on other aspects of my recovery. And within 5 days of my surgery, I was discharged from the hospital. Using my holistic approach to recovery, I only focused on physiotherapy and rest. And with this new attitude, I was completely off painkillers within a week of my surgery, as opposed to the normal 6 weeks for most patients. However, my journey was far from over. Even after I left the hospital, I struggled with countless things. I was still experiencing a lot of pain. I had severe fatigue. But what really brought my spirits down was my inability to do anything without help. There were days where I did not feel like eating. I lost a significant amount of weight in a week. One night, my stitches fell out and I had to be rushed to the emergency room. Normally, I see myself as a fairly independent person. I like to do things myself. And having to ask for help with tasks as simple as getting up from bed was so belittling. There were so many moments where I just wanted to feel normal again. And living in this constant state of helplessness exhausted me mentally. It became just as much of a physical journey as a mental one. My impatience with my recovery came back. And once again, I went down a hole of frustration and vexation. My progress was not linear. I had good days and bad, but the idea that if I kept going, I would be back to my normal self in a few weeks is what helped me remain determined. A few months go by, I'm now fully recovered with 2 rods and 17 screws in my spine, and wondering, if I ever had the chance to give a TED Talk, what would I say about my journey? I hadn't even been selected at this point, but I'm sure you'll appreciate my confidence. This is when I went back to the question, why me? Until grade 11 and my surgery, I had horrendous grades in math, and I had pretty much accepted that there wasn't going to be much improvement. Everyone told me that consistent practice would solve my problem. But until I went through this experience, I lacked 2 vital qualities: resilience and patience. My pain and condition weren't things that I could just accept. It was an infuriatingly long process, but I had to stay the course. My experience and everything I went through taught me the true meaning of the words. So, I had the answer to my question. It was me because I needed to learn and grow. It was me because I needed time off the grid, away from my phone, away from school, and away from all the distractions to focus on only myself. What I initially thought was a stroke of bad luck turned out to be my biggest life lesson so far. So today, here I am, exactly 1 year and 24 days post-surgery, with a healed spine, a striking scar to show for it, and fantastic math grades. All thanks to my new grasp on resilience and patience. Thank you.